just address it right away. No, acupuncture should not hurt. When people come in and they're like, my labs are fine, all my hormone labs look perfect, why am I not getting pregnant? But as a Chinese medicine practitioner, we're going to be looking at that a little bit differently. In those 3 months, that's really the time that you're making sure that everything is running beautifully and that eggs are getting all of the nutrients, all of the blood flow, all of the oxygen they need to be their best little egg selves.
So, do you get a lot of people pregnant? Hello and welcome to IVF Companion. I'm Allison, and this is the channel that I wish I had when I started my IVF journey. So resources, tips, storytelling, expert advice and guidance through interviews, and a little bit of my story and stories from others. So I hope every episode leaves you feeling a little less alone. Today, I'm excited to sit down with Dr. Karen Lang. So Dr. Karen Lang is a doctor of acupuncture and a licensed acupuncturist in Longmont, Colorado, where she runs Karuna Acupuncture. And Karuna is a Sanskrit word meaning compassion, which tells you a lot about how she approaches her work. Karen is a fellow of the Acupuncture and TCM Board of Reproductive Medicine, which means she has advanced training in optimizing fertility, integrating acupuncture with IUI and IVF, and addressing conditions like endometriosis and PCOS. She also provides prenatal, postpartum, and menopause care. Her approach goes beyond the needles. She takes extended appointment times to really listen and works with the whole person: diet, stress, mental health, lifestyle. And as she puts it, people heal when they are seen, heard, and valued. So, Karen, welcome to IVF Companion.
Thank you. I am so happy to be here. I'm so thrilled that you're doing this.
Great. Yeah. And you are the first person I'm interviewing. And having been a patient of acupuncture myself, I was just really excited to introduce people to the concept of acupuncture, really. Some of my questions will be about, really digging into like the beginning steps of understanding it, because some people entering into their fertility journey they've never even thought of it until now. Mm-hmm. In the moment when we want to try everything and hear about every possibility that can improve our egg quality or, help that embryo stick. But first, I want to hear about this person sitting in front of me. So tell me about what has shaped your life in such a way that brought you to focus on reproductive health and fertility.
Yeah. So my background is in social work. I spent about 20 years doing sexual violence prevention in all sorts of different contexts, and then got pretty burned out from talking about rape every day and really wanted to make a change where I was still part of people's healing and health, but looking a little bit different. And acupuncture had totally transformed my own health. So I went to school. And when I went to school, I spent 4 years in acupuncture school, and I didn't really go with this big intention of like, I'm going to do fertility, I'm going to do reproductive health care. I graduated, I hung out my shingle, and women just started showing up. And it sort of found me. And I just think all my years of working with women within the context of violence against women, it was a natural fit for me. And so women started just showing up, wanting support for fertility, support for painful periods, you name it, for reproductive health. And so I just started learning absolutely everything that I can. That's what I love about this medicine, is that you never stop learning and growing. And just doing that deep dive, I totally fell in love with it.
Wow.
So I've been doing it for over a decade now, with most of my focus being on reproductive health, fertility, and pregnancy.
Wow. You mentioned that acupuncture had transformed your health and your life, so I just didn't want to breeze right by that. I'm just wondering, are you open to sharing more about what that has meant for you?
Yeah, totally. I was having headaches every single day, these crushing headaches. And I tried, like most people, I made my way through all of the different Western medicine realms, tried everything that they had to offer. Nothing was helping. And finally, somebody was like, well, have you tried acupuncture? And I was like, that's weird, but I'm like really desperate at this point, which is how a lot of people come in, that they've tried all the things. And so they're like, let me just go ahead and try this. And I did. And she got rid of my headaches. So it was years later that I decided to go to school for acupuncture. But my first visit there, she was so amazing. It was this just oasis of calm and peace. And I just thought, oh my God, Sarah has the best job in the world. She just works in this beautiful, peaceful, calm environment. She just kind of floats in and puts in the needles and floats out.
Nice.
And meanwhile, I'm like, my calendar looks like a Tetris game of meetings. Yeah. So that obviously made a big impression. And that's how I want my practice to be for people.
Okay. So thinking about the first timers, in my fertility life, I have spent more time than I'd like to admit in Reddit, in the IVF subreddit, coming with my own problems during maybe that 2-week wait, or it's a lot of waiting, or if I can't get a hold of my clinic, right? So people come there under stress and curiosity about, have you tried this, this, and this? So I've seen a lot of questions about acupuncture. And in some instances, I see, well, I tried it, and I got off the table, and nothing was different for me. While in my experience, sometimes that's true. I get into a really chill state, I kind of float away. But I'm wondering if you could kind of set expectations about acupuncture for fertility, for someone who might be thinking they're going to come in and it's going to be changed right away, or just talk about that if you could.
Yeah, absolutely. And I'm glad those Reddit subthreads are there, because I have patients that come in and they'll be like, oh, this person tried this IVF med, and what do you think about that? Should I talk to my RE about that? It's sort of this crowdsourcing of information, which can be valuable at times and can just be a whole different mix of things at times, which is why I'm glad you have this channel too. So setting expectations, typically when you go see an acupuncturist for fertility, you should be planning on going generally weekly for at least 3 months. And there's a variety of reasons for that we'll talk about. If somebody isn't ovulating at all, or maybe has been diagnosed with premature ovarian insufficiency, something like that, you might be going more often than once a week initially. But generally once a week for 3 months is a basic general guideline. And part of the reason for that is that eggs mature in 3-month cycles. And so to go from not mature to the egg that becomes a dominant follicle and gets ovulated is about 3 months. And so that is the window that you are really supporting egg quality and optimizing egg quality. Also in that time, about 3 cycles, you should be getting a good handle on if there's irregular cycles, if there's painful periods, if there's, PMS, those sort of things that are like red flags, right? That hormone balance is maybe a little suboptimal. And so in those 3 months, that's really the time that you're making sure that everything is running beautifully and that eggs are getting all of the nutrients, all of the blood flow, all the oxygen they need to be their best little egg selves. So that should be sort of your base expectation for engaging in acupuncture. And a lot of acupuncturists then, in addition, will be maybe prescribing you herbs or maybe very curated supplements.
And what about during an embryo transfer specifically? Can you walk me through what that process looks like? Because I've heard things, right? Day of, maybe day after, but can you just clear that up for me, how you approach that?
Totally. So the initial research on acupuncture and IVF really focused on acupuncture that was done immediately before and immediately after a fresh embryo transfer. Now, we haven't done fresh embryo transfers, and that's what we were doing when I first started, but it's been a long time, although they are starting to do those again. But that was the initial research, and it was, generally speaking, very positive. Research has evolved, and what we know about our medicine is also kind of informing. So typically, the way I would work, let me back up. Ideally, for somebody, even if it's a frozen embryo transfer, we're doing some of that preconception work ahead of time, right? If you don't have 3 months, a month, right? Whatever we can get of preconception work ahead of time. But oftentimes I'll see people 4 weeks ahead of time, 1 month. And so we're going to do twice a week, typically electroacupuncture 4 weeks before your frozen embryo transfer. It's what a lot of REs are recommending because there's also some really nice research around that. But we know dose matters. And so the before after sure is helpful. 4 weeks ahead of time, twice a week electroacupuncture, even better. Even better than that, a little bit before those 4 weeks, right? To do some of that preconception care, to really address if they're, unless it's, purely kind of a male factor, to address some of those underlying things that are happening that sort of led you to this place to begin with, so that we can also do some of that work. And what we're doing in those 4 weeks ahead of time, right, is we're working on endometrial receptivity to make sure that your endometrium is ready for this embryo to burrow in and have a healthy transfer, have a good transfer. We're improving blood flow to the uterus. We're working on stress relief, right? That sounds kind of secondary, but it's primary, right? When we're totally stressed out, when our nervous systems are unbalanced, when we're kind of stuck in fight or flight, right? Because this is a big deal, right? You've done a lot to get to this point. There's a lot riding on it. And so really calming the nervous system is going to help that hormone balance, is going to help that endometrial receptivity.
I mean, I've heard that it's important to laugh after your embryo was transferred.
Yeah, right?
And I give more credit to that than the whole McDonald's fries thing. I think laughter is if you heard about that, eating supposedly McDonald's fries is supposed to help. Yeah.
Yeah. Pineapple, the whole 9 yards. Actually, yeah, there was, I wish I could remember the details right now, but there was a study that did look at, I think they were bringing in clowns around embryo transfer.
Not to me, you won't.
Okay. That might not work for you. But yeah, that whole laughter is medicine, right? Joy is medicine.
Yeah. Okay. And male factor. So I don't think about this often, because I just, usually speaking to women, I'm just thinking about that audience. But I mean, you probably have patients coming to you for male factor infertility, right? Is there a treatment protocol for them? Just or maybe you're treating both the woman and the man?
Yeah, when there's male factor, that would be ideal. Yeah. I have to say, at least in my practice, I'm mostly seeing women, even when, so 50% of the time when heterosexual couples are having a difficult time getting pregnant, that there is some male factor involvement. But yes, there are protocols, herbs to support better sperm health. Similar, right, to the egg maturation process of 3 months, sperm mature around 70-ish days. So you have this window in to make improvements. The good news about sperm is that they respond really well to antioxidants. And so if there's male factor involvement, but maybe he's not really wanting to see me or wanting to go see an acupuncturist, diet and lifestyle changes I'll be recommending, and then recommending supplements that have herbs to support, whether it's morphology, motility, count, right? There's different herbs that support different aspects of sperm health. High-level antioxidants, all of those are really helpful in improving sperm health. Mm-hmm. So there's a lot that men can do, and they don't even have to come in for the needles.
And do those needles hurt, Karen?
Doctor,
does it hurt?
Oh my gosh, biggest question. Yeah, it's one of the first things I do when somebody sits down in the chair if they haven't had acupuncture before. I just address it right away. No, acupuncture should not hurt. You might feel a little achiness, tingly, zing, but it really should not be painful. Sometimes you might have points that are a little bit more sensitive than other points, or sometimes you generally might feel more sensitive to the needles than other times. Maybe you're a little dehydrated, overcaffeinated, sleep deprived, right? And so your nervous system is a little bit more on high alert. And so when that needle goes in, it's communicating with your nervous system. And so you're going to feel that a little bit more. But if anything, continues to be uncomfortable, then your acupuncturist should adjust it. The goal is really to put you into a parasympathetic state, to really get you to be able to take a nap on the table if possible.
Okay, so if something hurts, there's no need to endure it because that means it's working type of thing.
Yeah.
Okay.
Yeah. I have patients all the time who are like, oh, I must have really needed that point. It hurt.
All right.
Maybe yes, maybe no.
Yeah. I think that's coming from other therapeutic techniques where it's like, oh, you're doing the work, so it's painful, but not in this case.
Yeah. We're not doing dry needling for fertility.
Okay. Dry needling does hurt. I've done that. Okay. So when I go in for my treatments, I am fascinated by this whole checking of the pulses thing. And I've noticed that my practitioner is able to just hold a full conversation while listening or, feeling these pulses. But can you tell me, what are you finding out there, especially as it relates to fertility? Like, what are you feeling into in the pulses?
Yeah. So in Chinese medicine, pulse taking is a little bit different than Western medicine. So you have 3 pulse positions on each wrist. So 6 pulse positions total. And we're listening at different depths. And so what it's telling us is generally the state of qi, energy, and blood in the body. But each pulse position is corresponding to a different organ system. And so we're able to feel and be like, oh, how's liver and gallbladder doing? How's spleen and stomach doing? How are those kidney reproductive energetics feeling? And pulses are really, they're very changeable. So your practitioner might take them at different points in the process, or checking to see, I really wanted this heart pulse was a little wiry. I wanted it to smooth out. Like, has that happened? But it's another way, just gives you insight, right, into what's happening internally, which is the same reason why everybody gets to stick their tongue out at us too.
Oh, yes, there's that. So top and bottom of the tongue is going to tell you something. Okay.
Yeah, so we're looking at the color, the coat, and the body, and those sublingual veins, and also giving us a sense of what's happening internally, right? So if you've ever had ever had some sort of phlegmy upper respiratory infection, right? That's really phlegmy. And then you're like, God, I have this really thick coat on my tongue, right? That's all that phlegm that dampened the body.
All right. And you also mentioned blood. And I was thinking about that too. I hear, blood building in terms of Chinese medicine, the importance of that. Kind of don't understand it. I mean, well, I understand it in terms of you're going to go try to build a human being, right? You need things to construct that being. But how is that done? I don't know. Like, I haven't heard this from Western medicine, of course, which I'll get to another question of East and West working together here. But tell me about how you view blood building. What do you know about that?
There's your overall state of blood, and then menstrual blood are kind of 2 different things in Chinese medicine. So Tianghui is your menstrual blood, which is a whole complicated Chinese medicine set of processes for how Tianghui comes to be. And then there's kind of your blood that kind of flows through your veins and nourishes your body, right? And so those are 2 different things, but we're looking at both of them. Okay. And we're nourishing blood. So symptoms where you might want to think about, do I need to think about blood building, would be, the Western medicine tests of like, are you anemic? Is your hematocrit and hemoglobin always kind of trending on the low side? Is your iron saturation or your ferritin really low? Those would be like the Western medicine equivalents. But in Chinese medicine, we might diagnose you with having some blood deficiency, and those might look fine, right? I went to see my first acupuncturist. She took my pulses, and she looked at me and said, "Do you eat meat?" And I said, "Why, no." I haven't ate meat since I was a teenager.
Mhm.
And she just said, I'm only going to tell you this once. It's totally up to you, but your pulses feel like a shallow, rocky river, and they should feel like a smooth flowing stream. And so you need to build blood. And at that point, my labs were fine. Now, fast forward a good 6-7 years, my labs were completely not fine. But at that point, right, Chinese medicine was picking that up at that point. And so things that you might see with that are, especially in the reproductive health realm, would be really light short periods, like scanty flow. I'll oftentimes have women come in and they might bleed 2 or 3 days with a really light flow. And so that's telling me, oh, okay, right? Like we have some issues with blood here.
Mhm.
Or sometimes really dry skin can be like there's a lack of nourishment for the tissues, right?
Okay.
Sometimes when things aren't healing well, like one of the reasons why I see that dry needling might not have long-term results for all people, right, is that they don't have good blood nourishment for their tissues, right? And so you're like needling beef jerky instead of prime rib. And so those treatments aren't going to hold until you're building blood to really nourish the tissues. But, I think that speaks to one of the things that Chinese medicine is really useful or excels at are when people come in and they're like, my labs are fine. All my hormone labs look perfect. Why am I not getting pregnant?
Mm-hmm.
Right? Like what would be characterized as unexplained infertility. And so the labs look fine. But as a Chinese medicine practitioner, we're going to be looking at that a little bit differently and seeing like, oh, well, where are the areas where health might be a little out of alignment? So yeah, right, your estrogen and your cycle day 2 FSH and LH look good and all of that is looking fine. But we're seeing some of these areas that may be impacting fertility.
Okay.
And then we can get into a whole thing about silent endo and unexplained infertility, but that might be a talk for another time.
Okay. So you might look at someone's labs that maybe they had done with another doctor, or do you ever send someone for labs?
I can do labs.
Mm-hmm.
I try to have them do it through their doctor, so it's covered by insurance.
Yeah, sure.
But yeah, so either labs that I order or labs that they've had done, I'll read.
Okay.
And I'm looking at them and it's like, oh, okay. Sometimes they come in and it's really clear what's going on, right? We'll have labs done and I can take a look and be like, okay, like this seems clear what I'm seeing here. And sometimes everything looks like textbook.
Mm-hmm.
But when we start drilling down into, what is their menstrual cycle looking like? What is the whole month looking like? What is PMS looking like? How is ovulation going? When is it happening? What is stress looking like? Those sort of how well are you sleeping? So if you're having some things in Chinese medicine we would talk about is like heart heat, right? So your follicular phase temps are kind of bouncing all over the place, then that's gonna impact fertility. And so there's some of those things that aren't going to show up in Western labs, but can contribute to some challenges in getting pregnant.
Okay.
Just like my acupuncturist was able to see, oh yeah, you have blood deficiency. It wasn't showing up in my labs yet.
Yeah. But nice when those things kind of like correspond. Like you see it in different ways. You might see it in the labs. You might feel something in the pulse, right?
Yeah.
So speaking of those things coming together, an IVF patient is going to face many voices, right? You've got your reproductive endocrinologist who maybe is the same person taking you through your IVF protocol, right? You've got your friend that's maybe done it and thinks you should try this supplement and you should take CoQ10 and like all this, or you should or you shouldn't take these things. You should have coffee. You shouldn't. Okay. So I've shared before that I always felt like I was doing something wrong depending on what I would read on a given day or minute. So how can you help look at someone who is going through IVF at a fertility clinic and working with acupuncture? Like, how do those worlds work together? Can there be harmony? And this can just be like from your experience. How do you do it?
Yeah, I mean, there really there should be harmony um, in that approach and in that relationship. So I work integratively. Not everybody does, but I'm trained to look at and understand Western labs, to look at and understand your calendar, your IVF calendar. What are the meds you're taking? When? Why? How are you taking them? All of those. So an understanding of that, and then the Chinese medicine understanding. And so what I'm doing on my end is really working, regardless of when you come in. So I have people who come in because they had two failed retrievals and they're getting ready for their third. And they come in at that point, or I'll have folks come in because they want to do the preconception care before they get started. And sometimes they get pregnant before they ever, end up in the RE's office. So it sort of runs the gamut. But if you're kind of in the process already, if you're in the process for doing stem cycles for retrieval, or you're in the process for your embryo transfer, then I'm working to optimize wherever you're at in that process, while also addressing any of those kind of underlying things that I'm seeing as a Chinese medicine practitioner that are going to influence your outcomes. So sort of a whole systems approach.
So do you get a lot of people pregnant?
Yeah. That's the best day.
That might be for the blooper reel, but I love it.
It's my favorite day. My second favorite day is when they bring in their babies.
Oh my gosh. Yes. So what are some red flags? Like if someone's searching for an acupuncturist, they sit down and have their first day, what should not be happening? What shouldn't they hear or feel or have done?
I mean, I don't know. People practice differently, right? I'm a social worker. I've got like a warm, touchy-feely practice because that's who I am and that's how I work. So it's not to say that somebody who maybe is a little bit more clinical, or, I mean, not that I'm not clinical. I am wearing jeans. But who is maybe a little bit, more just kind of matter of fact, white coat going, isn't going to get great outcomes, right? Like part of it is who you resonate with. And so I tend to have people come into my clinic that resonate with how I practice. But, to my mind, if you're seeing somebody for fertility, then they should be really doing a deep dive, both in your reproductive health history, your menstrual cycle, and then your kind of whole health and well-being, right? That there should be a pretty deep investigation of what's happening there. I don't know. I can't think of like a specific like red flag. Like
No,
they should definitely not do this, right? Because there's going to be different styles.
Yeah.
And they're just different people.
Right. That was a very fair way of answering the question, to more of what should be happening instead of the red flags. Yeah. For me, I think I would have my own personal ones. Like, if I don't vibe with them, if I don't feel comfortable, we have a journey to take together. So if I'm not resonating, like you said, or if there's just too much pain, then that's probably not it.
Yeah. And I've had people come see me that had been working with an acupuncturist, had a great relationship with them. They were seeing them for something other than fertility, and just kind of realized like, oh, I probably need to see somebody who this is their thing, right? This is what they know inside and out. Like I'm not a sports medicine practitioner, but if I have an injury, like I would want to go to see somebody who like really jams and does orthopedic, and they have all this advanced training in orthopedics. And so the same is sort of true with fertility.
Okay. Yeah. Got it. Has there ever been a situation for you where you find you need to refer someone elsewhere if they're coming to see you for acupuncture, for IVF, or maybe they're at a point in their cycle where acupuncture is just not as helpul as it could be, and you want to say like, come back when you're doing this?
So acupuncture really works on bringing the body back into homeostasis. And given that there isn't a time when I've been like, yeah, this isn't useful right now. If people financially need to prioritize, like if it's just too much, then I will work with folks to be like, all right, then let's have you come right before ovulation and right before wherever, right? Like wherever the point in their cycle that things kind of fall apart a little bit. And so in that way, yes. But I haven't had and I'll definitely refer to other practitioners if I want them like, oh, maybe this naturopathic doctor is, really amazing on gut health. And I really would like you to, do a consult with them because I think they're going to be able to do some testing that I just don't do or that sort of thing. Like I'll definitely bring in other practitioners that are going to have complementary expertise that I think would be helpful.
Talk to me about how acupuncture can improve egg quality and what that process is like.
Yes. And first, I want to talk about AMH.
Sure. Okay.
Right?
Yeah.
Yeah, because if you're on the fertility train, if you're on the IVF train, right? Like AMH is a big deal. Or it's a big thing in your life oftentimes. And it's something that can cause a lot of stress and consternation for people. And so what I spend a lot of time doing with my patients is helping them see that AMH does not equal egg quality, right? So AMH, your anti-Mullerian hormone, is an approximate marker of your ovarian reserve. And so for some people, especially folks in IVF, that marker might be really low. They might have very low ovarian reserve, either appropriate to their age or maybe not quite in alignment with their age. And that can be a source of stress and consternation. And in fact, I think some clinics don't even put when they are doing all the labs, sometimes they won't even upload the AMH because I think they don't want folks kind of stressing on it, right? Perseverating on it. And so yes, it's important, but it's not the whole story, right? And so even if you have a low reserve, you can still impact your egg quality, which is much more important because that's what's going to create that healthy embryo.
That's huge. I feel like that's been a stopping point, and some clinic doctors will stop women and be like, "Listen, your AMH is low," and then they just use that and go from there. And I've had friends and family that have considered turning away once they heard the AMH point blank.
Yeah. And, for sure, like there might be, if your AMH is, consistent with like a postmenopausal state along with labs, then yeah, there might be places where IVF is not going to necessarily help. But it's not the whole story. And I feel like it's important, but there's a disproportionate importance put on it when there's a lot we can do around egg quality. It's not fast, though. And so I think that can be one of the hard things if you're already kind of in the IVF pipeline to take that step back and say, all right, I'm going to take 6 months and work on egg quality before I step back on the treadmill to do this. Like that, that emotionally can be really hard to take that break.
Yeah. I have absolutely rushed through parts of the process because I didn't want to hear that.
Yeah, it's hard. Yeah. You don't want to have to step back because you're like, time is ticking, man, and I'm ready for this baby.
Yeah.
But if you have a chance, right, to be able to influence your egg quality, and then there's things that you can do that can be helpful. So, of course, acupuncture is one of them, right? We talked about how eggs mature in 3-month cycles. And so with acupuncture, what you're doing is you're helping bathe those ovaries in better blood flow, in better nutrients, get the hormones there, lower the oxidative stress, lower the chronic inflammation that's going to impact the egg quality. And that can come from all sorts of things, endo, of course, being one of them. But where a lot of us are just sort of chronically in this sort of inflamed state with high levels of oxidative stress. And so for sure, acupuncture, herbs always. My abdominal therapy is awesome for that because it's another way of is supporting blood flow to all the reproductive organs. But diet and lifestyle are huge, right? So eating an anti-inflammatory kind of pro-fertility diet, working on, I know, everybody's like, oh, just don't stress, right? Like it's not that easy, but how do we build in micro mindfulness moments? How do we sort of build in these places in our lives to kind of lower that allostatic load on our body that's taking a toll? So there's a lot of things that you can do to support egg quality. And, CoQ10 is actually pretty good too for that. And vitamin D.
I know. I do think it's good. That was just me trying to stir drama. I do think I swallow. I took like 600 milligrams or something.
Yeah.
I took a horse pill because I did feel like it was important.
Yeah. There's research support.
Yeah.
And there's all sorts of new technologies out there, PRP and all sorts of things like that. But there's a lot you can do to improve egg quality. And so to not get so hyper focused on the AMH, it's important to know, but it's not the whole story. But that it is going to take some time.
Can Chinese medicine help with preventing miscarriage at all?
Oftentimes, yes. I mean, it depends on the cause of the miscarriage, right? Oftentimes, if there's a chromosomal abnormality, the body is doing what it's supposed to do, right? If that chromosomal abnormality is like not compatible, right, with the embryo or fetus continuing. So the body is sort of doing what it is supposed to do in that. But I've had a lot of patients who have had recurrent pregnancy losses and with no known kind of etiology or no known cause for that. And we've been able to do the preconception work, right, to take a look at what's contributing to these multiple pregnancy losses and then support them through that first trimester. And those women that I've seen have had successful pregnancies. And so it's something that I am really passionate about. What I like for all of my fertility patients, whether they've gone through IVF or whether they've gotten pregnant naturally, is to do weekly acupuncture through the first trimester. So really what we're doing is we are helping your body maintain a healthy pregnancy. And then with IVF, it can be common to have something like a subchorionic hematoma. And so using acupuncture and moxibustion, right, to help shrink that and help with that piece. But that is something that I recommend to all of my patients through generally week 12. And then I'll see them monthly after that.
Wow. That sounds really important because I think a lot of people know that after embryo transfer, you're getting through that 2-week wait. And it can be hard to celebrate even if it's a positive.
Yeah. Yeah.
Because you've got the scans.
You kind of hold your breath through the first 12 weeks, really.
Yeah.
Yeah.
So this is a question that I will start asking everyone I interview. What's one thing that you would say to someone going through IVF right now, from your heart to theirs?
I mean, I could be glib and say one of my patients said that her major advice for people going through IVF is make sure you have your IVF support sweatpants.
I mean, loose waistband.
Yeah.
Yeah. Yes, ma'am.
Yeah, get your people around you to love on you. Right? Like it's whether that is your family, your friends, your partner, your acupuncturist will love on you, your, a support group, whatever. It's long, it's hard, it's lonely. Right? Mm-hmm. So lean in to where you can get that love.
That's beautiful.
Oh. Easier said than done, but yeah, you don't have to go it alone, I think is the thing, right? Like there's so many, they might be hard to find, but there's a lot of resources out there, including this, right? To help people feel less alone and give them the resources.
Okay, now if anyone listening is interested in searching for an acupuncturist in their area, where can they start?
So the first place I would go would be ABORM, so the Acupuncture and TCM Board of Reproductive Medicine. So it's aborm.org. So folks who are ABORM fellows like myself, we sat for a extremely rigorous voluntary board exam, followed after doing tons of CEUs specific to fertility, right? So anybody who's an ABORM fellow is really going to know fertility from a Chinese medicine and a Western medicine lens inside out. Mm-hmm. If you don't have an ABORM fellow in your area, then you can check with any of the fertility clinics because they'll oftentimes have practitioners that they refer to.
Okay, thank you. And thank you for coming on. I'll have your website in the YouTube description. And yeah, this has been really valuable.
Well, thank you for doing it. And thank you for asking. It's been a huge honor.
Absolutely. Hey, I hope you enjoyed this video. Please remember to like and subscribe if you want to be notified on what's happening next. Also, I would appreciate it very much. Look below for a link to a free packing list that I designed for anyone going to IVF in another country. Please, I promise that it'll be helpful, and I look for feedback on how have you tailored it to yourself. Another link is there to join the mailing list for IVF Companion so I can keep you updated and hopefully send you an invite to our forthcoming community in Circle. Thank you.